Telehealth. TRT in Australia seems more accessible than ever, but it's not a wellness hack. Doctors are legally barred from prescribing it for anti-aging. Qualification demands two things: clear symptoms and confirmed deficiency on your blood tests. A legal online prescription is valid, but the process is strict for your own safety. We'll now break down the exact medical criteria, the diagnostic process, and the commitments. Your path doesn't start with a script. It begins with a detailed online questionnaire about your symptoms, history, and lifestyle. Doctors are looking for clinically recognized symptoms: persistent fatigue, low libido, brain fog, and a drop in physical performance. Feeling tired for a week isn't enough. These symptoms must be significant and persistent to warrant medical investigation, but symptoms are subjective. To get a prescription, you need hard data. So what are the exact numbers that matter on the blood test? Before the numbers, how you get tested is vital. Blood must be drawn early, between 7 and 10 a.m., after an overnight fast, and a single test won't cut it. Doctors need at least 2 separate tests on different days to confirm a consistent deficiency. Okay, the numbers. Doctors often look for total testosterone consistently below a line like 15 nanomoles per litre. This is a diagnostic boundary, not a performance goal. Why so specific? Your testosterone is naturally highest in the morning. A later test could give a falsely low reading and an incorrect diagnosis. This isn't just about total T. Doctors need a complete picture of your hormonal and general health, so a full blood panel is mandatory. They'll check free testosterone, the active portion, SHBG, the protein that binds it, plus LH and FSH to check signals from your brain. Then come safety checks: prolactin and estradiol, a full blood count for your red cells, and a prostate-specific antigen, or PSA test. So, your tests are done and your numbers are low. Are you automatically approved? Not necessarily. Now we enter clinical pathways and costs. There are 2 routes in Australia: subsidised through the PBS or private. For a government subsidy, the criteria are incredibly strict. You need a total T level below 6 nanomoles per litre on 2 separate occasions confirmed by a specialist. Most men with low T do not meet this. Let's be clear. A man with a level of 8 nanomoles per litre can have severe symptoms, but he will not get a subsidy, which is why most telehealth TRT is private. Doctors will also assess your lifestyle. Chronic poor sleep, obesity, or high stress can cause low T and must be addressed first. If you're borderline, or if other markers like PSA are elevated, you may be declined and referred to a specialist to find the root cause. Let's say you meet all the criteria and are approved. What are you actually signing up for? Is this a short-term fix you can stop? The answer is no. TRT is a long-term medical therapy. Starting it suppresses your body's own production. Stopping can cause a crash. Another huge consideration, especially for younger men, is fertility. TRT suppresses sperm production, impacting your ability to conceive. Qualifying is just the beginning. Adherence to ongoing monitoring is mandatory. This is not a set-and-forget prescription. You will need follow-up blood tests after the first 8 weeks, and then regularly every 4 to 6 months to manage your dose and safety. So, let's connect the dots. Why is this entire process, from initial tests to ongoing monitoring, so rigid and structured? Recall those initial safety markers we mentioned, like PSA and hematocrit. They are the exact things doctors monitor long-term to manage risks. This is the core of legitimate TRT. The strict diagnostic process directly informs the ongoing monitoring protocols. One cannot exist without the other. This rigorous, doctor-managed process is what separates legal telehealth TRT from the dangerous, unregulated products you might see for sale. The path is clear, but it's narrow for a reason: your safety. So what is the key takeaway from all of this? Qualifying for telehealth TRT in Australia isn't a shortcut. It's a medical process requiring symptoms, proof from blood work, and long-term commitment. It is fundamentally different from a general wellness or anti-aging approach. It's about managing a legitimate medical deficiency. If you're experiencing symptoms, the first step isn't to seek a product, but to seek a proper diagnosis. Go to your doctor prepared. Take your health seriously. Speak with a registered Australian doctor who follows these strict protocols. It is the only safe way to know if TRT is right for you.